I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say and then address those things you disagree with. I'll make sure I save time for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number 2, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even ask in your support for legislation that's before the Congress. Drug pricing. Senator Durbin and I have for a while been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for rural community hospital demonstration programs. It also ignored concerns from rural pharmacies when implementing changes to Medicare Part D, and ignored rural needs when it comes to distributing physician residency slots. I expect you to prioritize rural Americans' health care needs. On agriculture, in our meeting earlier this month, we talked at length about agriculture. You prefaced the conversation by saying you will not have jurisdiction over these issues. I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, that's USDA and EPA. On dietary guidelines, I've sent letters to the Secretaries of Agriculture at HHS requesting that they provide information regarding conflicts of interest on the Dietary Guideline Advisory Committee to increase transparency. I expect you to provide Congress with confidential financial disclosures from the Advisory Committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence. Lastly, HHS, Office of Refugee Resettlement Oversight. Last year, I expanded my investigation into HHS's Office of Refugee Resettlement. I wrote 24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children have been placed with improper vetted sponsors, placing them at risk of trafficking. The Biden administration's HHS directed these taxpayer-funded contractors and grantees to not respond to my inquiry. This is obstruction by the executive branch. I expect you to produce to me the records and data I've requested and instruct HHS contractors to fully cooperate with my investigation. I also expect HHS to not retaliate against any whistleblowers, including those who identify ORR's failures in vetting sponsors of unaccompanied. You got 45 seconds to respond if you want to.
I agree with all of those provisions, Senator. My approach to administration HHS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies. HHS and its sub-agencies, NIH, CDC, FDA. on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case. And if Congress asks me for information, you will get it immediately.